Everyone, welcome to researchmd.com. We've been doing most important clinically relevant high-yield questions. So today we're going to look at the cardiology section, and my name is Dr. PRAMIL. Let's go into our question, okay? So we got an elderly person, 90-year-old. The question is going to be framed like that. You got a 90-year-old patient coming in, and we get really tired when you do activities. All the other tests were normal, so what do? They do an EKG, and they found out his heart rate is like 48 beats per minute, but EKG showing only sinus bradycardia. Okay, and the other thing they're providing is, we have an ambulatory, they put a Holter monitor, it could be like 48, 72 hours of ambulatory monitoring of the EKG, showed that the heart rate remains slow, maybe around 70, and even during the vigorous or strenuous activity. Okay, so what should we do in that situation? What need to be done? That's a clinical concept we're trying to learn today. Now, the first thing we need to look at, what's the most common answer people pick? What is the most people think? You did an EKG, everything was normal, no heart block or anything. Let's watch this guy. That's the most common wrong answer. Reassurance. Nope. We have to do something about it. This patient needs a pacemaker. Okay? So we have to look at there's a large number of indications for pacemaker, but we're going to look into this category. Why does this patient need a pacemaker first? This patient is having something called a sinus node dysfunction. How do we know that? We have to see, when we monitor the EKG, right? When we do strenuous exercise, our heart rate should go up, right? That's why when we have a stress test, there's a formula. You take the 220 minus age, that's the maximal heart rate. You want the heart to work up so you can get the secrets of the heart out, they say. So 220 minus age. And you should at least, when you do regular exercise, strenuous activity, you should be able to reach 85%. Okay, so let's look at this case. This guy is 220 minus 90. He's 90-year-old, right? That is 130. Right? You should at least reach 85% of the heart rate when he start walking and all that. But his heart rate is still not going up. That phenomenon is called chronotropic incompetence. Okay, so the word you have to remember is the chronotropic incompetence is going on in this patient. And if you have chronotropic incompetence, what is the first thing you have to do? You have to put a pacemaker in. Okay, there's a million other indications right here. Main thing I would say, high degree AV block. There's a CHF is less than 35%. So many questions we can ask, but don't forget about the chronotropic incompetence, because even the vigorous activity, the heart rate is not going up. The normal phenomena is if I start working hard, if I get excited, my heart rate should go up. In this guy, heart rate is not going up. It's still symptomatic. Do the pacemaker. Thank you so much for watching. We'll be back with another presentation soon. God bless.